Hello there, my name is John Faulkes and I want to introduce this video version of a presentation that David Davies and I gave at the Partnerships in Clinical Trials conference in 2016. The key message of this presentation is something that we recommend as an enhancement and an expansion of the bidding process, which could give a sponsor increased confidence of successful delivery. We call it risk-based proposals. So follow me through this brief slide set to learn more, and we do welcome any questions as a follow-up. Understandably, we always approach a clinical project with a comprehensive plan designed to meet its goals, to comply with necessary safety and regulatory requirements, to finish on time and within budget. Our industry has very many years of experience at planning clinical trials, so you would think that we'd be able to meet these challenges most of the time. The reality is very different. You may be only too familiar with these statistics about partnership working in general, which say that some 60% of them fail to achieve the objectives that were established at the beginning. Specifically for clinical trials, the stats are even worse. It's said that as many as 80% of all clinical trials fail to perform efficiently. What we mean by this is that in order to achieve their goals and levels of quality, there are usually overruns and overspends. However, these findings are not slowing us down, and there continues to be a huge global demand to do clinical work. Yet, if we look at the CRO side of the fence, that doesn't mean that things are simple. Pulling together all the information and resources needed to submit, say, a proposal to do a phase 3 study can cost on average $80,000, and even the major CROs will plan on winning only 1 out of every 4 proposals they submit. So we can say that clinical trials are a large dynamic business, but clearly seriously inefficient. Sponsors frequently complain about CROs not delivering what's been promised. But is there anything you can do that's different and practical that can increase confidence as a sponsor? And for CROs, can you do anything more than you do already to communicate to a sponsor the value your organisation can bring to a study and therefore win more proposals than you do? What we're going to talk about is a proposal to enhance and change to some extent the standard process we use for the selection of CROs, a rough representation of which we show here, and in particular the segments shown inside this area. But first, let's take a further critical look at the current process. Let's look at what we will typically see in a proposal from a CRO. We should acknowledge that when sponsors have made a decision to proceed, they may send an RFP to a selection of CROs, which, considering it is for a highly complex multi-million-dollar project, allows a very short time indeed for them to put together a serious bid. This and some other considerations drive certain outcomes. CROs may assume that sponsors are looking for the lowest price quote. This may not necessarily be true, but it often is. Because CROs are under pressure to respond so quickly, and because their hit rate is so low, they have a difficult balancing task. They will do the maximum amount of analysis in the short time available, but have to supplement it with generic or boilerplate content, which any proposal might be expected to contain. Sponsors will expect to see and will want to include the maximum amount of information about relevant experience. In summary, the CRO will want to provide a can-do orientated bid that shows them in the best light in order that they get the business. As we will explain in the next few slides, there is one huge omission from this content, and it's that there is frequently no serious consideration of risks and risk planning. There is one thing we should remind ourselves of when we kick off with an optimistic plan, but we often don't. And that is that almost every trial will encounter issues, which require changes to plans and necessitate extra work. Our bidding process may lead us to have a little too much faith in the quoted budget and timing, and so when the CRO asks us for extra payments for change requests, we naturally become irritated. Some of these inefficiencies are due to the fact that we may not have realised a useful opportunity. CROs have lots of experience. They could have detailed feasibility data related to the therapy area and the indication in which you're planning to work. They have a wealth of internal resources with many years' expertise. They have the capability and willingness to review published literature and benchmark information, all of which can help to predict and therefore better manage the issues that you will run into. However, with the typical bidding process, there is no incentive for them to do this. We want to suggest a practical way to take advantage of this and, for the whole timeline of the project, increase confidence of delivery. We suggest that instead of seeking a proposal from each CRO, the sponsor should seek two. The initial proposals should be reviewed to compare the basic bare bones costs of each. But then, from all of the shortlisted applicants, request a second, more expansive proposal that includes risk identification, risk mitigation plans, including costings based on the protocol. Costs are incorporated for likely contingencies, so the sponsor is not distracted at critical points by protracted negotiations over changes in scope. This process allows for better definition of the cost elasticity in the budget. This way of working also offers the opportunity to risk share. For example, if the CRO has not delivered according to minimum performance standards, then they could be required to instigate the contingencies at their cost. Now, of course, we are having to confront the extra vigilance we require around quality and safety, forthcoming changes in good clinical practice, and the risk-based monitoring that will follow from that. But as well these days, we are needing to control costs and timelines, and risk-based proposals help us to do that. When we make a selection of a CRO partner, we can use their risk awareness and risk planning capability as a key differentiator. The rationale for a risk-based proposal is based on known and typical metrics demonstrating that the costs of dealing with arising issues that were not foreseen in a bare bones proposal can rise alarmingly, and in some cases out of control. Realistically planned contingencies can anticipate many of these issues, with the cost of their resolution agreed in advance. There may be some costs for enabling work for these contingencies, but should the issues not arise, the overall spend will not be that much more than the bare bones estimate. But it's an insurance against the worst case, which so often happens. An additional benefit is that the contingency plans will be ready to deploy, so that if issues do occur, there will be minimum impact on the project timeline. So, although what we are proposing seems like it will consume extra energy, time and cost, we think that there are real benefits that outweigh this. A CRO's risk analysis and contingency planning enables a sponsor to really differentiate and make a judgment about their suitability as a partner. Flagging up many issues that may occur and can be planned for means that the arrangement is much more likely to deliver and close to the planned cost. It will reduce the number of unplanned change requests. Having the opportunity to do this gives a CRO a solid way to demonstrate their capability and forge common expectations for the reality of study operations. With more confidence that there will be a minimum of nasty surprises during the project, the partnership can also work with more trust, empowerment, and a spirit of collaboration. Well, that's the end of this short presentation. Thanks very much for taking the time to watch through it. As I said at the beginning, we do welcome any comments or follow-up questions, so do get in touch at any time using the addresses you can see here. Bye for now.